Hello, my name is Dr. Javier Ruiz, and I'm a medical oncologist and hematologist at Montefiore St. Luke's Cornwall Hospital. And today I want to talk to you about colon cancer. Colon cancer is a cancer of the large intestine, which is the final part of the digestive tract. Most cases of colon cancer begin as small, non-cancerous, which is benign, clumps of cells called adenomatous polyps. Over time, some of these polyps can become colon cancers. Polyps may be small and produce few, if any, symptoms. For this reason, doctors recommend regular screening tests to help prevent colon cancer by identifying and removing polyps before they turn into cancer. What are some of the symptoms you can develop? Well, there are signs and symptoms of colon cancer, which include a change in your bowel habits, including diarrhea and constipation, or a change in the consistency of your stool that lasts longer than 4 weeks. Rectal bleeding or blood in your stool can also be seen. Persistent abdominal discomfort, such as cramps, gas, or pain, are some of the other symptoms. A feeling that your bowel doesn't empty completely, weakness or fatigue, unexplained weight loss. Many people with colon cancer experience no symptoms in the early stages of the disease. When symptoms appear, they'll likely vary depending on the cancer's size and location in your large intestine. Let's talk about risk factors. Older age. The great majority of people diagnosed with colon cancer are older than 50. African American race. African Americans have a greater risk of colon cancer than do people of other races. A personal history of colorectal cancer or polyps. Inflammatory intestinal conditions. Ulcerative colitis and Crohn's disease can increase your risk of colon cancer. Also, inherited syndromes that increase colon cancer risk, and these are genetic syndromes passed through generations of your family, can increase your risk of colon cancer. In other words, things like Lynch syndrome. Family history of colon cancer, that includes colon cancer history of your parents or of a sibling or a child. Low fiber or high fat diet can also increase your risk. Diets high in red meat and processed meat are also a risk factor. Sedentary lifestyle. Diabetes, obesity, and smoking are well-known risk factors. Alcohol. Heavy use of alcohol increases your risk of colon cancer. Radiation therapy for cancer can also be a risk factor. Let's talk about prevention now. Eat a variety of fruits, vegetables, and whole grains. Drink alcohol in moderation, if at all. Stop smoking. Exercise most days of the week. Maintain a healthy weight. And get screened for colon cancer. Now, the most important tool for screening is colonoscopy. During a colonoscopy exam, a long flexible tube, known as a colonoscope, is inserted into the rectum. A tiny video camera at the tip of the tube allows the doctor to detect changes or abnormalities inside the entire colon. Colonoscopy takes about 30 to 60 minutes, and screening is generally repeated every 10 years if no abnormalities are found, and you don't have an increased risk of colon cancer. The pros of a colonoscopy. Colonoscopy is one of the most sensitive tests currently available for colon cancer screening. The doctor can view your entire colon and rectum. Abnormal tissue such as polyps and tissue samples can be removed through the scope during the exam. The cons of colonoscopy. The exam might not detect small polyps and cancers. A thorough cleansing of the colon is required before the test. Diet changes are needed before the test. and medications may need to be adjusted. Sedation is almost always used, and it can take several hours to wear off. Because of the sedation, you'll need someone to drive you home. Rare complications may include bleeding from the site where a biopsy was taken, or polyp or other abnormal tissue was removed, or bleeding from a tear in the colon or rectal wall. Cramping or bloating might occur afterward. And those are the basics of colon cancer.